the unprecedented surge in norovirus hospitalizations across England has reached alarming levels, surpassing all previous records, with experts attributing this dramatic increase, at least in part, to a regression in hygiene practices prevalent before the COVID-19 pandemic. Newly released data from NHS England paints a stark picture. An average of 1,160 patients per day were hospitalized with norovirus last week, representing a substantial 22% jump compared to the preceding week. This figure stands in stark contrast to the same period last year, where the daily average was a significantly lower 509 patients. The sheer volume of norovirus cases is placing an immense strain on the already overburdened healthcare system. Hospitals are operating at near maximum capacity, with occupancy rates exceeding 95% for adult beds. This critical situation is a confluence of factors, primarily the increased demand for hospital services exacerbated by significant delays in discharging patients who are medically fit for release. A concerning statistic reveals that nearly 1 in 7 beds is currently occupied by patients ready for discharge, further compounding the bed shortage crisis and hindering the capacity to accommodate new patients, including those afflicted with norovirus. The reemergence of norovirus with such intensity has prompted a closer examination of potential contributing factors. Experts point towards a concerning relaxation of hygiene practices since the peak of the pandemic as a significant contributing factor. While the COVID-19 pandemic spurred a notable increase in hand washing and hand sanitization during 2020 and 2021, this positive trend has unfortunately reversed. A widespread complacency regarding infection control has seemingly taken hold, with individuals exhibiting a decreased vigilance towards hygiene. Research consistently demonstrates that despite the heightened awareness of hygiene during the COVID-19 pandemic, a significant decline in hand hygiene practices has been observed since, commented a leading epidemiologist. This relaxation of preventative measures has created a breeding ground for the resurgence of easily transmissible viruses such as norovirus. Surveys conducted across the nation have revealed some deeply concerning statistics. A staggering 1 in 5 individuals admits to not always washing their hands after using the toilet, a practice fundamental in preventing the spread of infectious diseases. Equally alarming is the fact that approximately 4 in 10 people neglect to wash their hands before preparing or handling food, creating a significant risk of contamination and further contributing to the spread of norovirus. The current situation underscores the critical importance of maintaining rigorous hygiene practices, even in the absence of a widespread pandemic. The seemingly simple act of regular and thorough handwashing remains one of the most effective tools in preventing the spread of infectious diseases like norovirus. The stark reality of overflowing hospitals and the suffering of countless individuals serves as a potent reminder of the vital role personal hygiene plays in safeguarding public health. The collective responsibility to prioritize hygiene practices is paramount in mitigating the impact of norovirus and preventing future outbreaks. The NHS is urging the public to maintain stringent hand hygiene and to stay informed about the symptoms of norovirus to help prevent further spread and reduce the strain on the already overstretched healthcare system. The return to pre-pandemic habits, experts caution, carries significant health risks and necessitates a renewed focus on preventative measures.